And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today, this is a video that is specific for women because we're going to be talking about breast size as it relates to neck pain, headaches, and also back pain. And I fully understand this is a weird thing to be talking about coming particularly from a guy. This is not something that I have to face on a day-to-day basis, but we're talking about where women are particularly busty and how it's relating to what goes on through their spine, where to the point they're actually thinking, okay, maybe a breast reduction is actually an appropriate medical solution. And this is actually interesting from a timing perspective here, because just in the last 1 week, I had a client reach out to me where we'd had the conversation that, yeah, we think that breast size is contributing to some of the ongoing aches and pains that she had. But what she needed was a letter from me saying that it was my opinion that she would actually need this type of surgery with medical benefit. Well, just a couple of days after this, I come across this particular article that I'm going to share down in the resources here, because if you fall in this category, this is not just a factor of vanity. This is about something that can really make a positive impact on your overall health well-being. So let me go ahead and share that with you here. Okay, the association between female breast size, backache, and quality of life in young women, a cross-sectional study. What the authors here talked about, first and foremost, is that this is a topic that, yeah, is recognized clinically, but there really haven't been too many studies done to discuss, is it important or is it appropriate where a woman might genuinely need to consider a breast reduction surgery. What they did was a cross-sectional study of 200 women. They were aged 18 to 36 with chronic issues with neck pain, headaches, and upper thoracic pain. And they do all kinds of statistics on it. Here's what they come up with, which is kind of interesting. So, results. Back pain prevalence increased with breast size. If a woman had only a B cup, quote unquote, only a B cup, we don't mean anything by that, but 4.9% of the respondents said, yeah, that they get recurrent issues in their neck or their back. But if it was double D or E cup sized, 85% of women said that they were having issues, and the overall level of discomfort going on what's called a visual analog scale, so scale simply of 0 to 10, 10 being the very worst and 0 being pretty much non-existent, is women with the B cup, they were rating on the average about a 0.3 out of 10, versus women with the double D or the E, 6 and beyond. And every 1 centimeter or half of an inch approximately increase in band length raised the odds of back pain by 20%. So those are some pretty interesting numbers that showing that, yes, there is a pretty strong correlation that the larger the breast, the larger the bust size, you have substantial increases in overall levels of pain or discomfort. So the conclusion of the authors here: breast size was strongly associated with the presence and severity of back pain, particularly in the thoracic and cervical or neck regions. Clinicians should consider breast size in the assessment of backache, and reduction mammoplasty, that is breast reduction surgery, may have therapeutic value beyond aesthetics. So again, I know this is a weird conversation to be having, especially coming from a guy, but I can remark on this just in all of my years of experience. Well, firstly, I suppose the family side of the equation. The women on my dad's side of the family are particularly busty. Grandmother, a few cousins, my sister, and not all, but a handful have actually opted to have breast reduction surgery. And I've also had many clients over the years, same thing, where they're very rounded through the shoulders like this. You can see that everything is pulling forward and just heads coming forward like this. One of them was a girl. She was 17 years old when I first saw her. And when she turned 18, because her mother, also very, very busty, had recommended that she would have this particular surgery. And what her response was, she said that after the surgery, there was just, everything hurt, as it certainly would after a major surgery like that. She said everything hurt. But when things healed up within just a few weeks, she said she could breathe so much better. Her headaches went away. Her neck pain went away. And when I was doing my, own checks on her, she was holding her adjustment. She was doing great. We didn't need to do near the amount of work that we were doing before. So I can simply comment that in my own observation, that I have never yet encountered a woman who's experiencing neck and upper back pain from breast size who opts to have a breast reduction surgery. I've not had one case to date, and there are always exceptions out there, of a woman who has actually regretted having that procedure. The hard thing then is oftentimes finding the medical validation, wondering, when and where is it perhaps appropriate for me to even consider this as an option. So number one, certainly is if you are having ongoing neck and back pain, and if you do have that suspicion that breast size may have something to do with it. Number two, you're doing all of the right kind of exercises. So you're stretching the pec muscles open like this. You're trying to expand open the chest, but you still find that your shoulders roll forward so that if you're relaxing your arms down at your side like this, your hands kind of roll in like that. That's where, simply put, there's mass in the front, that no matter how much exercise you do on your back, everything is just pulling you forward like this. But also then you've now got this particular article that shows that you've got a 12-fold increase in neck and upper back pain going from a size B up to a size double D or an E. But in addition to that, that if you do have every 1 centimeter increase in bust size, you've got a 20% increased probability of experiencing pain. Now, that doesn't always mean that the first thing that you should do would be to rush out and have a breast reduction surgery. One thing that I actually advise a lot of my female clients first, I ask them candidly, because again, it's weird coming from a guy, but I ask, when is the last time that you have been professionally fitted for a bra? Because bust size does change as we age, kind of the same as shoe size. The foot actually expands. Well, because of gravity, breast size and also having children can change over a woman's life. So just because something that she maybe had professionally fitted when she was 25, if she's now 30, 35 and has had a couple of kids, that bra size may no longer be appropriate. In which case, finding something that offers a little bit more support can be very, very beneficial. As I had also said, of course, working to stretch and open the chest, work on the back muscles. But then, as we said, is if you're still struggling with so many of these different kinds of things, no matter how much PT, chiropractic you do, you get relief, but it doesn't last too terribly long, then in all seriousness, breast reduction might be a really good option for you. And I repeat what I had said, is to date, I've not had a single client who's ever had that procedure done where they've ultimately regretted it, because they said, yes, it feels like losing a little bit of yourself, but in the same breath, you just feel so much better on the other side of that, that ultimately well worth it. So again, weird conversation, but important one to have out there. And again, I've put the link for this particular article, that if you're having a conversation with an orthopedist, with your family care physician, whoever that would be, that you would actually have this particular article that is going to support your medical decisions so that you can be feeling as well as you possibly can. So hope you have enjoyed this little video. Again, a little bit of a weird one, mind you. But if you did find benefit, please always click that like and subscribe button, where we'll do all kinds of different content just to help people feeling better. And feel also free to share this video with friends or family members if you think that they'd benefit from this information. This is Dr. Jeffrey Hanna, Clear Chiropractic. Get well, live well, stay well.